What actually happens to the insulin level in type 1 and type 2 diabetes mellitus? Why one is called absolute deficiency state and type 2 is called relative insulin deficiency state? That I'm going to explain in this short session. So in type 1, it's clearly an absolute deficiency of insulin state, because what is happening, it's very easy to understand, because what is happening, the factory which manufacture insulin, that is the beta cells of the islets of Langerhans, they get progressively destroyed. They get destroyed by the autoimmune process, because body's immune cells, particularly T lymphocytes, they start to think that the beta cells in the pancreas, in the islet of Langerhans, they are bad, they're something foreign, and they cannot tolerate them. So there's a failure of self-tolerance, which is called. That means my immune tissue, my immunological cell is basically attacking my own tissue. So T lymphocytes of the patient, they progressively destroy the beta cells of the islets of the Langerhans. So as a result, what happened? There is a progressively low amount of insulin is produced, and when more than 90% of the beta cells are destroyed, it presents with type 1 diabetes mellitus. The story of type 2 diabetes mellitus is a little bit different. What happens to the insulin level in type 2 diabetes mellitus? Type 2 diabetes mellitus, the key problem is insulin resistance. That means insulin was there, but it cannot act on its peripheral receptor. So initially what would happen in type 2 diabetes mellitus, that insulin level would increase to compensate for that, to overcome that resistance. But progressively, beta cells would understand that this is a futile attempt, because however increased amount of insulin they release is not going to overcome that problem actually. So they would burn out the beta cells, and progressively, initially the insulin secretion would increase, but later you'll be seeing there's a beta cell dysfunction, functional dysfunction. They cannot produce enough amount of insulin. So in type 1 diabetes mellitus, what we are getting absolute deficiency of the insulin. That means there's hardly or no amount of insulin is produced, or very little scant amount of insulin is produced. In type 2, the thing is that the main problem is insulin cannot act on the insulin receptor. You can think like this, that there is a lock and key there, but lock and key is not fitting with each other. So the door cannot open and cells cannot enter into the glucose cannot enter into the cell. In type 1, the problem is there is no key there. So as there is no key there, you cannot open the lock. So glucose cannot enter inside the cell. And type 2, the level of insulin, type 1, the level of insulin is always consistently low. But in type 2, level of insulin varies with time. Initially, level of insulin increases, because the main problem in type 2 is insulin resistant. But with time, the insulin secretion also decreases. So how to see the graph actually in type 2, you'll be seeing that there is a initially rise of the insulin level, but that does not solve the problem, because the main problem is insulin resistant, and then progressively there will be decrease that. How I think this scenario, it's like, you can think like bodies, beta islet cell of Langerhans, the body think like, you can assume like them or imagine like they're donkeys, and those donkeys are shown some carrots that if you work harder, if you secrete more insulin, then you can overcome that insulin resistance. The problem would be solved. But donkeys, after running hard for a long period of time, they would understand that nothing is happening, nothing is changing. They keep working hard, but the problem is not getting resolved, the problem of insulin resistance. So then they would burn out, they would be exhausted. So they would stop synthesizing more insulin. So this state actually would happen in the type 2 diabetes mellitus. So type 2 diabetes mellitus, insulin resistance would be there. To overcome insulin resistance, there would be a higher amount of insulin secretion, initial phase of the disease. Then the beta cells would be burned out, they would be exhausted, and then there would be progressive decrease in the insulin secretion. And typically this kind of scenario which you see in the type 2 diabetes mellitus, it is called relative insulin deficiency. But in type 1, it is called absolute insulin deficiency. That is the key thing that you need to understand. That type 1 is a state of absolute insulin deficiency state. Type 2 diabetes mellitus is a state of relative insulin deficiency state. Thank you so much.